raise the arm out, tell me at what point it starts to hurt.
Oh, click then.
Clicked.
Oh, it's hurting there.
Okay, and whereabouts is point to it with the other hand?
In here.
In there. And then if you go forward.
Yeah, I can feel it in here. It doesn't hurt all that much, but I can feel it.
Can you go any further? So what happens there is that the actual the glenohumeral joint stops moving, and the movement's coming from the scapula. So you get to here and it's painful, and then to get back you're actually leaning back. So there's a problem actually in the rotator cuff at the moment. If you raise it out to the side, same thing.
Yeah.
Glenohumeral rhythm on that 2 to 1. So the humerus moves 2 for every 1 that the scapula moves. That's reduced. We'll check internal rotation. Painful if it is, just let me know. So it's reduced internal rotation, and extend back. Again, tell me if anything. And you can't. There's no external rotation at all in the shoulder joint, and that's due to pain and restriction around the shoulder. And let's get you to lie on your back, please. So I'm going to check just some ranges of motion, pulling the shoulder out, superior to inferior, inferior to superior, and coming across. I'm just going to stress the shoulder joint and push down. Tell me if it's painful or stop. And across.
Oh.
Okay. So, alright, so it's tender on the biceps tendon. Hold the palm facing up. Pull up towards you. Okay, keep going. Okay. Okay, so there's probably a little bit of biceps tendonitis. Okay, so just rest there. I'll just get a model. You can hold on, so we know what it is now. And so if we can come over, I'll just show you.
Oh, you want me to come over?
Oh, and you can come over as well. I'll help you up.
Yeah, thanks.
Okay, so if we look at the shoulder joint, so this is called the glenohumeral joint in here. And so the humerus and the glenoid labrum of the scapula. So when I said the 2 to 1, so for every 2 degrees that the arm moves, the scapula moves 1 degree. And what happened with the patient is that I'm asking to raise out to the side, and she gets to about here, it's painful, and to get movement with the arm up higher, she's having to either twist from the spine or the rotator cuff so tight that it's not moving. And the rotator cuff is on the back of these wing bones. If you look at the body from behind, the wing bone is the scapula, and there's the rotator cuff muscles that help the arm stay on the rib cage. Looking at an X-ray, probably from this X-ray, you can see the actual part of the scapula up here, and you can see the top of the arm, so we call that the humerus, and this is the glenohumeral joint in here. The undersurface of it on this particular one is tilted, is anterior, and generally though the outline of this shows that there's no real degeneration on the top of the humeral head. It's nice and smooth, and even the part of the scapula is nice and smooth. So we're just going to continue assessing, and we've ruled out any kind of soft, any bony growths or degeneration in the shoulder joint, so that isn't necessarily the cause of the problem.